Many people assume memory loss is simply part of getting older. But in some cases, the real cause may be hiding in the medicine cabinet, and recognizing it early could help you have a more informed conversation with your doctor. Have you ever walked into a room and suddenly forgotten why you went there, or struggled to remember a familiar name or an important appointment? Moments like these can feel unsettling, especially after the age of 50. Most people immediately think, this must be normal aging, and sometimes that's true. But not always. As doctors, we sometimes discover another piece of the puzzle hiding in a place many people never think to look: the medicine cabinet. Now, before you worry, let's be clear. This does not mean your medications are harmful or that you should stop taking them. Many medicines protect your heart, control blood pressure, ease pain, or even save your life. The goal of this video is not to create fear. It's to help you become more informed. Research suggests that certain medications may affect memory, attention, or clear thinking in some people, especially as we grow older. The effects can vary from person to person, and in many cases they can be recognized and managed with the help of a healthcare professional. In the next few minutes, we'll explore which common medicines deserve a closer look, why they may influence memory, who faces the greatest risk, and the simple steps you can take to protect your brain while continuing to receive the treatment you need. Because sometimes the answer isn't simply getting older. It may be something you can discuss with your doctor. But before looking at specific medications, we need to understand why the brain becomes more sensitive as we get older. To understand why certain medications may affect memory, it helps to know what naturally changes inside the body as we age. Growing older doesn't automatically mean your memory will decline, but it does mean your body handles medicines differently than it did in your 30s or 40s. Think of your brain as a busy highway filled with millions of tiny messages traveling back and forth every second. These messages help you remember names, stay focused, make decisions, and react quickly. Some medications can slow that traffic. Instead of information moving smoothly from one place to another, the signals take longer to reach their destination. That's one reason people sometimes describe feeling foggy or mentally slower. Another important factor is how the body processes medications. The liver and kidneys act like natural filters, breaking down and removing many drugs from the body. As we get older, these organs may work a little more slowly. That means certain medications can stay in the body longer, increasing the chance of side effects, including changes in thinking or memory. Many adults over 50 also take more than one medication each day. While each medicine may be appropriate on its own, combining several prescriptions, along with over-the-counter products or supplements, can sometimes increase the risk of unwanted interactions that affect the brain. It's also important to understand that not all memory problems are the same. Occasionally, forgetting where you left your glasses is something almost everyone experiences. Medication-related confusion often begins after starting a new medicine or changing the dose, and may improve when the cause is identified. Dementia, on the other hand, usually develops gradually and affects daily life over time. Knowing the difference can help you ask the right questions without assuming the worst. Now let's look at the medications doctors most often review when someone suddenly develops memory problems. Let's begin with 3 groups of medications that doctors often review when an older adult reports new memory problems. Remember, this doesn't mean these medicines are unsafe or that everyone who takes them will experience side effects. In many cases, they provide important benefits. The key is understanding when they might contribute to changes in thinking. The first group is sleeping pills. These medications are commonly prescribed to help people who struggle with insomnia or frequent nighttime waking. Because their job is to slow brain activity and encourage sleep, some of that calming effect can last into the next morning. Instead of waking up feeling refreshed, a person may feel unusually groggy, forgetful, or have trouble concentrating. For older adults, this lingering drowsiness may also increase the risk of falls, especially when getting out of bed during the night. If this happens regularly, it's worth asking your healthcare provider whether the dose, timing, or even a different treatment for sleep might be more suitable. The second group includes anti-anxiety medicines, especially those used to calm intense anxiety or panic symptoms. These medications can be very helpful when used appropriately, but they may temporarily interfere with the brain's ability to form new memories or stay mentally sharp. Older adults are often more sensitive to these effects because their bodies process the medication more slowly. For people who have been taking these medicines for a long time, Doctors may occasionally review whether the current treatment is still the best option. Any changes, however, should always be made gradually and under medical supervision, never by stopping the medication suddenly. The third group is older, strong allergy medicines, often known as first-generation antihistamines. These are commonly used for allergies, itching, or even as sleep aids. While they can be effective, they may also block brain chemicals that play an important role in memory and attention. Along with dry mouth and drowsiness, some people, particularly older adults, may notice confusion or difficulty thinking clearly. If you rely on one of these medicines, ask your healthcare provider whether a newer alternative with fewer effects on the brain may be appropriate for you. The next medicines are even more surprising because millions of people take them every single day. The next three medication groups often surprise people because they are commonly prescribed and, for many individuals, work very well. Yet, in some situations, they can also affect how clearly the brain functions, especially later in life. First are certain bladder control medicines, often prescribed to reduce frequent urination or sudden urges to use the bathroom. These medications work by blocking specific nerve signals that control the bladder. The challenge is that similar signals are also involved in memory, attention, and clear thinking. In some older adults, this can lead to forgetfulness, difficulty concentrating, or feeling mentally slower than usual. That doesn't mean everyone will experience these effects, but if memory changes begin after starting one of these medicines, it's a good reason to have a conversation with your healthcare provider about possible alternatives. Next are certain antidepressants. Here's an important myth versus fact. Myth: all antidepressants cause memory problems. Fact: most do not. In fact, treating depression often improves memory and concentration because depression itself can make thinking less clear. However, some older antidepressants are more likely to cause drowsiness or interfere with brain chemicals involved in memory. That's why doctors carefully consider age, overall health, and other medications before choosing the right treatment. The goal is always to balance benefits with potential side effects. The sixth group includes opioid pain medicines, which may be prescribed after surgery, serious injuries, or for severe chronic pain. These medications can be very effective for controlling pain, but because they slow activity in the brain and nervous system, some people may notice reduced alertness, slower thinking, confusion, or problems with balance. These effects are often more noticeable when treatment first begins, when doses are increased, or when opioids are combined with other medicines that also cause drowsiness. It's important to remember that everyone responds differently. Two people taking the same medication at the same dose may have completely different experiences. That's why regular medication reviews are so valuable, particularly if you've started a new prescription or noticed unexpected changes in memory or thinking. Never stop a prescribed medication on your own. Instead, work with your healthcare provider to find the safest approach for your individual situation. But we're only halfway through the list, and the next group includes medicines that often surprise even well-informed patients. Let quote S continue with 4 more medication groups that doctors may consider when investigating new memory problems. Once again, these medicines can be very important for treating serious health conditions. The goal is not to avoid them, but to understand when extra attention may be needed. The 7th group includes certain anti-nausea medications. These medicines are often used after surgery, during cancer treatment, or to control severe dizziness and vomiting. Some older anti-nausea drugs can cause drowsiness, slower thinking, or temporary confusion because they affect chemical messengers in the brain. Older adults and people already taking medications that cause sleepiness may be more likely to notice these effects. If family members suddenly observe unusual forgetfulness or excessive sleepiness after a new anti-nausea medicine is started, it's important to let the prescribing healthcare provider know. The 8th group is muscle relaxants. These medications are commonly prescribed for painful muscle spasms or back injuries. While they can ease discomfort, many also reduce activity in the central nervous system. As a result, some people experience brain fog, slower reaction times, or difficulty concentrating. In older adults, these effects may increase the risk of falls, especially when getting up quickly or walking at night. If a muscle relaxant is necessary, doctors often recommend using the lowest effective dose for the shortest appropriate time while monitoring for side effects. The 9th group includes certain seizure medications, also called anti-seizure medicines. These drugs are essential for controlling seizures, and some are also prescribed for nerve pain or migraine prevention. Because they work by calming electrical activity in the brain, a few may cause temporary problems with attention, memory, or mental speed, particularly when treatment first begins or the dose is increased. These effects often improve as the body adjusts, but any persistent changes should be discussed with a healthcare professional rather than ignored. The 10th group is older antipsychotic medications. These medicines may be prescribed for certain mental health conditions or, in specific situations, for severe behavioral symptoms. Because they affect several important brain chemicals, some individuals may develop drowsiness, confusion, or slower thinking. Older adults, especially those with existing memory concerns, require careful monitoring while taking these medications to ensure the benefits continue to outweigh the risks. A common thread runs through all 10 medication groups we've discussed. Not everyone will experience memory changes, and many people take these medicines without significant problems. What matters most is recognizing new or unusual symptoms, keeping an updated medication list, and communicating openly with your healthcare provider. Sometimes a simple adjustment in timing, dosage, or medication choice can make a meaningful difference while still treating the original condition safely. So, how do you know whether memory changes are coming from medication or something more serious? Occasional forgetfulness happens to almost everyone, but some changes should never be brushed aside as just getting older. Knowing the difference can help you or someone you love get the right care at the right time. One of the biggest warning signs is memory problems that appear suddenly. If someone who was thinking clearly a few days ago becomes noticeably forgetful after starting a new medication or increasing the dose of an existing one, it's important to contact their healthcare provider promptly. A change like this may be related to the medication, an interaction between medicines, or another medical condition that needs attention. Pay close attention if memory changes are accompanied by confusion, such as not recognizing familiar places, becoming disoriented, or struggling to follow a simple conversation. Other concerning signs include seeing or hearing things that aren't there, known as hallucinations, or feeling so sleepy that it's difficult to stay awake during normal daily activities. Falls are another important warning signal. Sometimes what appears to be poor balance is actually the result of slowed thinking, dizziness, or reduced alertness caused by a medication. Trouble speaking clearly, finding the right words, or sudden personality changes, such as becoming unusually agitated, withdrawn, or suspicious, should also be taken seriously. These symptoms don't always mean a medication is responsible, and they certainly don't always point to dementia. In some cases, they may signal an infection, dehydration, a stroke, or another urgent medical problem. That's exactly why sudden changes deserve prompt medical evaluation instead of waiting to see if they disappear on their own. The most important message is this: never ignore rapid changes in memory or behavior, and never stop a prescribed medication without professional guidance. A timely conversation with your healthcare provider can help identify the cause and determine the safest next step. The good news is that many medication-related memory problems can often be improved once they're recognized. The encouraging news is that protecting your memory doesn't always require dramatic changes. In many cases, small, consistent habits and good communication with your healthcare team can make a real difference. One of the simplest steps is to keep an up-to-date list of every medication you take. Include prescription medicines, over-the-counter products, vitamins, and herbal supplements. Bring this list to every medical appointment. It helps your healthcare provider spot possible interactions or medications that may no longer be necessary. It's also a good idea to schedule a medication review at least once a year or sooner if you've started a new prescription or noticed changes in your memory. Don't be afraid to ask a simple question: do I still need all of these medications? Sometimes treatments that were appropriate years ago may need to be adjusted as your health changes. Be especially careful with over-the-counter medicines. Products for allergies, sleep, coughs, or colds can sometimes interact with prescription medications or increase drowsiness and confusion. Even though they're available without a prescription, they aren't risk-free, particularly for older adults. Healthy daily habits also support brain function. Drinking enough water can help prevent dehydration, which itself can cause confusion. Getting consistent, quality sleep gives your brain time to restore and organize memories. Regular physical activity improves blood flow to the brain and supports overall health. Just as importantly, protecting your hearing and vision helps your brain receive clear information from the world around you, reducing unnecessary mental strain. If you think a medication may be affecting your memory, never stop it on your own. Instead, start a conversation. Imagine saying to your doctor, "I've noticed I've become more forgetful since starting this medicine. Could it be related? And are there any safer alternatives?" That's a productive discussion that allows your healthcare provider to review your symptoms, weigh the benefits and risks, and decide whether a change is appropriate. Remember, the goal isn't to take fewer medicines at any cost. It's to make sure every medication continues to provide more benefit than risk for your unique situation. Working together with your healthcare team is one of the best ways to protect both your health and your memory. Before we finish, let's clear up a few common myths that cause unnecessary worry. Before we wrap up, let's separate a few common myths from the facts. Clearing up these misunderstandings can help you make better decisions without unnecessary worry. One common myth is, if a medicine affects memory, it's dangerous. The fact is that many medications are both safe and essential when used correctly. Like all treatments, they can have side effects, but those effects don't happen to everyone. The important thing is recognizing changes early and discussing them with your healthcare provider. Another myth is, natural supplements can't affect memory or interact with medications. In reality, natural doesn't always mean harmless. Some vitamins, herbal products, and dietary supplements can interact with prescription medicines or increase side effects, including drowsiness or confusion. That's why your healthcare provider should know about everything you take, not just prescription drugs. You may also hear, memory loss always means dementia. Fortunately, that's not true. Memory changes can have many causes, including medication side effects, poor sleep, dehydration, vitamin deficiencies, depression, or infections. Some of these conditions are treatable, and memory may improve once the underlying cause is addressed. Finally, there's the myth that stopping a medication is always the safest choice. In fact, suddenly stopping certain medications can be more harmful than continuing them. The safest approach is to work with your healthcare provider to decide whether any changes are needed and how to make them safely. So what should you remember from everything we've covered today? Let's bring everything together. The most important message from this video is that medications can sometimes contribute to memory problems, but that doesn't mean they are unsafe or should be avoided. Many of these medicines play an essential role in treating serious health conditions and improving quality of life. As we grow older, our bodies process medications differently, and taking several medicines at the same time can increase the chance of side effects or drug interactions. Even so, not everyone will experience memory changes. Every person responds differently, which is why paying attention to new or unusual symptoms is so important. If memory problems appear suddenly, especially after starting a new medication or increasing a dose, don't ignore them. Contact your healthcare provider promptly so the cause can be evaluated. Regular medication reviews are one of the best ways to make sure every treatment is still the right fit for your current health needs. Simple habits such as staying active, sleeping well, drinking enough water, and keeping an updated medication list can also support long-term brain health. Most importantly, never stop or change a prescribed medication without professional medical advice. One final thought may completely change how you think about protecting your brain. If there's one thing I hope you take away from today's discussion, it's this. Memory changes deserve attention, not panic. While aging can affect the brain, it's not the only possible explanation. Sometimes a medication or a combination of medications may be playing a role, and recognizing that possibility is the first step toward finding the right solution. In many cases, a simple medication review, a dose adjustment, or switching to a suitable alternative under your healthcare provider's guidance can make a meaningful difference. That's why it's so important to speak openly with your doctor or pharmacist if you've noticed changes in your memory or thinking. Never make changes to your medications on your own. If you found this video helpful, please share it with a parent, spouse, sibling, or friend. It could encourage someone to ask an important question at their next medical appointment. And I'd love to hear from you. Have you ever noticed memory changes after starting a medication? Share your experience in the comments below. Don't forget to like this video and subscribe for more evidence-based tips to help you stay healthy, independent, and informed as you age. In our next video, we'll explore 7 early warning signs your brain may be asking for help. You won't want to miss it. Until then, take care of yourself and stay curious about your health.